We are the Society for Healthcare Innovation. This is our interview series. Today we are lucky to have Srulik Dvorsky, the CEO and founder of Tailormed. Before we get started, I do want to read a quick statement from our society that addresses all that is happening in the world around us. While COVID-19 continues to threaten the world, the events of the last several weeks and months have reminded us yet again of systemic racism and health inequities. As a society dedicated to innovation in healthcare, we find it impossible to ignore the reason for the healthcare inequities that are embedded within the fabric of societies around the world. We are determined to inspire our community to use innovation as a means of addressing social determinants and other factors that contribute to the inequality of care and health among minorities and disadvantaged populations. We stand together with the victims of injustice and call for reflection, but more importantly, for action. Srulik, thank you again for joining us.
Hey, Corey, thanks for having me.
So as a starting point, I think it would be great if you could give a quick overview of Tailormed for our viewers.
Sure. So Tailormed is a health IT company founded by Adam Seaton, our CTO and my co-founder, and me about 4 years ago. And we basically built the company in order to address the challenges related to cost of care. Basically, for us, everything that stems from the fact that patients have really high out-of-pocket expenses for whatever the treatment they're requiring, especially around chronic and critical conditions. And we began early on by focusing on both the patient's perspective and the provider's perspective, and have built a very comprehensive solution to try and tackle what is now called financial toxicity, which we can talk more about, which basically represent the challenges from both a financial but also a clinical perspective for patients, and uncompensated care, which basically represents the challenges for revenue collections from the provider's perspective. The company has an automated system that basically finds resources of alternative revenue for the hospital, and the beneficiary is the patient, meaning that instead of having the patient pay the thousands and tens of thousands of dollars they need for whatever the care they require, we are finding them other alternatives like foundation grants, governmental plans, pharma copay cards, and even optimizing their insurance coverage. So that's Tailormed.
So in addition to taking some of the financial burden off of patients, are you finding scenarios where a patient would have had to stop receiving care for a certain condition that you're now able to allow that patient to continue to experience?
For sure, and I think that that's basically what the term financial toxicity is. So just to quote a few metrics around that, early on when we started, we focused on the oncology area and some metrics around cancer care. On the financial side, patients with cancer are more than 2.5 times likely to go bankrupt than a usual American. But also there is a very high correlation of higher mortality of those who are financially distressed. And the main trigger for that is lack of adherence. Basically, if you are, we heard some very discouraging sentence once about patients that rather be buried under dirt than under debt. Which basically means that patients are sometimes waiving or discarding their treatment because of their inability to even go into the office to get the copay for the physician, not to mention high-cost specialty drugs. So for sure, we're seeing that as a widespread phenomena, not only in oncology, even in lower price points for diabetes, for example, patients who are indigent, having a very hard time to renew their prescription. And, Corey, we are speaking now at the midst of the COVID pandemic and what's going on in terms of unemployment rates going up, uninsurance rates going up, and all of that contributing to a lower propensity to pay from patients is actually just exacerbating that. And we are very concerned about the patients that are, having less of an access to care, I would say.
We are the Society for Healthcare Innovation. This is our interview series. Today we are lucky to have Srulik Dvorsky, the CEO and founder of Tailormed. Before we get started, I do want to read a quick statement from our society that addresses all that is happening in the world around us. While COVID-19 continues to threaten the world, the events of the last several weeks and months have reminded us yet again of systemic racism and health inequities. As a society dedicated to innovation in healthcare.
So I think that definitely it wasn't hard to find the audience for the need before, and it's even more widely adopted, the concept that something needs to be done in order to lower the financial burden to patients, but also from the hospital's perspective to make sure that they are recovering more potentially lost revenues, especially about 50% of the revenues were lost because of ceasing elective procedure. It's definitely a challenge for them to try and adopt new technologies when everything that is going on makes them very, very tight on their budgets and their resources. And even some of our existing clients are furloughing staff because of the financial issues that the hospital has. But I think that I'm positively surprised to see that they do put that as a very high priority. And we have been able not only to go live with all of our customers that were in the funnel, we actually are onboarding more and more new customers during the pandemic. So I think that it's a time for a company like us to put together a proposal for those types of partners that will be more sensitive about where they are and build a longer term relationship. And that's what we do. And I think that it's helping them execute on something that is in the forefront of their priorities.
I wonder if you could take us through two scenarios. The first would be the patient journey, what it's like for a patient with and without Tailormed as they navigate the financial challenges of care. And the second would be from a health system perspective, perhaps looking at a subset of patients, how Tailormed helps to alleviate some of the payment issues that the hospital faces.
Sure. So I can give you an example of a multiple sclerosis patient. Recently, we've heard a story from one of the patients that were actually benefiting from our service. They are treating in one hospital system, actually a university hospital in Georgia. And that patient wasn't able to afford the chronic care that she needs. It's a high cost IV product. And she was extremely concerned about the fact that she cannot take the new refill, or in that case, like the new administration or the next cycle. What we did is that instead of the patient simply coming to the financial counselor, if there is one, and in that case there wasn't any, or waiving that treatment altogether, our system basically pulls data from the EMR and from the billing system. We compile those two in order to create a very comprehensive patient profile that allows us to project the out-of-pocket expenses for all of the patient population within a health system. And that allows us to pull the subset of patients that are more vulnerable. And she was part of that population. And basically what happened is one of our financial navigators proactively approached her saying, we see that there is a big bill coming up and there is an opportunity that can offset that bill for you that will give you only $25 copay. And she was amazed. She came into treatment. She obviously got that treatment, reported back to us, actually through the health system, that was something that she otherwise couldn't have afforded. From the hospital perspective, and that basically for us, that makes our day, and the team was excited to get that feedback. But if you took a look at that hospital system in a high-level view, they are seeing thousands of patients a day and let's say tens of thousands a year altogether. Being able to know which patients are expected to have a billing risk from the provider's perspective and making sure that the team, whether it's in-house or our team, works on those cases in order to first maintain the revenue stream and also make it shorter in terms of the collection time, increases the number of patients that they are able to assist between times 3 to times 5, what they've done before. And that has almost a direct correlation to the revenue increase that they are able to essentially recoup. And for us, that was key when forming the company. There is a clear win-win between the patient who is benefiting from getting the care and the direct bottom line increase that we are implying on our partners.
So did I hear you correctly? The hospital has a 3 to 5 times higher rate of being able to recoup funds with Tailormed as opposed to without?
Yeah.
We are the Society for Healthcare Innovation. This is our interview series. Today we are lucky to have Srulik Dvorsky, the CEO and founder of Tailormed. Before we get started.
Yeah, so I think that what we've done at the beginning is focused on where the highest cost medication is, and then started to expand to different therapeutic areas and different provider settings, I would say. And we are seeing now more and more adoption of our system in primary care, whether it's for drugs like insulin and Eliquis and different, even like lower cost drugs, but are taken for a longer period of time. And that's something that is growing within our provider network. But we are also starting to look not only within the provider space, but explore other opportunities, because if you think about it, the phenomena of having patients have very high out-of-pocket expenses will also impact employers and pharma and payers from different angles, don't get me wrong. But what we've built is a very strong technology that with slight variations can serve as a hub within the entire ecosystem. And that's for us, from the opportunity to expand is very promising, and we're going into that more and more nowadays.
Just from your perspective at a higher level, working with these health systems, how do you think this pandemic is going to change the way revenue cycle is run?
I think it's a great question. I think it's a bit early to say. I think that most of our partners are kind of in the stop the bleeding phase, meaning that they are only investing in what's essential from their perspective. And I'm guessing it's gonna, on the one hand, you can argue that telemedicine is going to have a significant impact on how they approach care. I think that there will be a peak, and then it will plateau on a different level. And I'm not sure that what we're seeing now in terms of payer reimbursement will continue, as it is very flexible at the moment. And I think that from a revenue perspective, going back to your question, there is a trend that I'm guessing will continue to make sure that both payers but also patients have a proof of payment as early as possible in the episode of care, whether it's through upfront payments, prior authorizations, to make sure that coverage is for sure. And that's kind of my take on that. I think that we're going to see new vehicles of funding for patients that for us are new tools that will be onboarded on our platform, just to make sure that we are able to optimize in all different variations of financial opportunities. And I think that something that started before COVID will continue afterwards is also some type of consumerization of that process. It is extremely difficult to understand an EOB, evidence of benefits for patients. Getting I just heard a story from Seattle about a patient that got I think 100 pages worth of EOB for their COVID treatment. By the way, the patient didn't have to pay anything, but he didn't know that because it was covered fully by the payer. So I think that those trends will continue around revenue cycle. But the problem still remains that the cost sharing dynamics between patients and payers are shifting more to patient. So whatever the tools are, and ourselves included, the problem is still there.
We are the Society for Healthcare Innovation. This is our interview series. Today we are lucky to have Srulik Dvorsky, the CEO and founder of Tailormed. Before we get started, I do want to read a quick statement from our society that addresses.
That's an interesting story. So my background came from medical device, actually in the neurology space. I spent 10 years in a device company, and during that time, I was also the caregiver of 6 members of my family who were diagnosed with cancer. And after leaving that company, it started to get an itch to try and do something with my day job, which is technology, and the passion I had to helping others getting better access to care. Eventually, I found myself drawn more into the convergence of healthcare and finance, both because of the immense challenges patients have there, but also from a venture perspective, I saw, how we can actually influence a lot of lives by growing a very big company.
We are the Society for Healthcare Innovation. This is our interview series. Today we are lucky to have Srulik Dvorsky, the CEO.
Sure. So I definitely think that when looking at different solutions, some doing fantastic work in trying to get patients better access to care like we do, we took a different approach, I think. We really believe that being able to build a full patient profile, not only what is the drug that the patient is taking, but what is the coverage and the benefit, and by that being able to project out-of-pocket expenses, allows us to take the concept of financial navigation, which is basically what we do, and change it to be proactive. Proactiveness means that you are not waiting for someone to find an assistance for a patient, but actually the system finds the patients with the highest financial risk and financial vulnerability, and then by predictive analytics, based on the technology that we have done, are able to drive more assistance, collect more revenue, and at the end of the day, deliver a significantly higher ROI than competitors. This is also, and it was, by the way, a side effect, or like a byproduct, I would say, that we have built, I think, the most comprehensive out-of-pocket calculator in critical care. We are projecting episode of care level estimations, which are starting to be used by most of our partners for transparency. And that allows them to have insights in depth that they didn't have before. And I think that it really depends on how, a prospective customer looks at the field. If they want to have something that eventually delivers, higher ROI, a platform that is not only one specific feature, they should choose us. And I think that that's the main difference.
Srulik, I think what you've built is awesome. Thank you so much for taking the time to speak with me today. I know you're a busy guy. We are the Society for Healthcare Innovation. You can find us on LinkedIn or on our website at shci.org. Thanks again.